Good morning, and thank you so much for the honor and the privilege of the opportunity to come and speak with you today. And to get us kicked off on the right note, I'm going to ask you, are you happy to be here? If you're happy to be here, say yes.
Yes.
Are you happy to be here? Say hell yes.
Hell yes.
Right, okay, and a big round of applause for everybody who's made this happen, including yourselves. Well done. The next thing I'd like to ask you to do is think about something that's made you smile this morning. Something that made you smile this morning, and then, because we know that physical activity is also a determinant of mental health, I'd like you to stand up, please. Turn to one of the people next to you or behind you, perhaps, and tell them about that thing that made you smile this morning. Okay, we'll start bringing it back together again. What a wonderfully compliant audience you are. That's marvelous. So I hope that's a little mental refresher for you, a little physical refresher for you. This is a picture of the wonderful city of Melbourne that I have the privilege of working and living in, and welcome from Melbourne, I guess. I'm going to talk a little bit with you about, I'm going to take things back to basics to start off with. Going to get the ground clear. Everyone in here understands what health is, but I want to revisit that. What is health? What's the position of mental health? And often when we talk about the mental health system. And then I'm going to talk a little bit about, as Pat alluded to, what are megatrends? What are these things that potentially have got really big ramifications for everybody in this room, and indeed for a wider global audience? I'll then tell you a little bit about a study that I was privileged to be a part of, working at Vic Health, the Victorian Health Promotion Foundation, the world's first health promotion foundation. And then I'll be reflecting, really, on what this might mean for some of the discussions that we're having today and thinking about youth mental health as we go forward into the future. And I'm really excited by the closing plenary today, of course, which is going to spin this on its head and look back from a successful future in 20 years' time into what do we need to do now from a solutions perspective. And as a public health person, often I think we get criticized as saying we're very good at describing problems, not so good necessarily at describing solutions. It's wonderful to have that solution orientation to the closing session of the day. So, about health. Normally when we think about health, or when most people think about health, as was alluded to by Francis's amazing presentation before, we think about its absence. And when we think about health systems, we usually think about something like this. But of course, as everyone in here understands, health is not about its absence. And as the WHO called out in 1948 in the State of Constitution, it's a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. And it's really important, of course, that this conference adopts this language and explicitly does so by talking about mental health. Not mental illness, not mental disease, mental health. That isn't to say that crisis and when people suffer is not important. But if that's all that we think about, we miss the wonderful potential, as was alluded to by Bill earlier, around the connections between our everyday well-being and practices and living life. It's perfectly possible to live a life, as Francis was showing very demonstratively there, with serious mental conditions and concerns, and live a full and happy and productive life. So just wanted to start off on that basic point. So what are the building blocks for mental health? And this is supported, of course, by many, many, many different studies in many different places. But if we think about health in that round perspective, rather than from a disease or condition-based perspective, what we see over a wealth of evidence is that meaning and purpose in life, good relationships with the people around us and within broader community, good work, being productive, a healthy lifestyle, particularly one that's where you're physically active and adopt the other healthy lifestyles that we know lead to a broader general healthy life, and supportive economic and social conditions are the building blocks, not just of good positive mental health, but also the prevention of mental suffering and indeed the treatment of many tough mental conditions. We know, for example, that physical activity, regular physical activity, is just as effective as many of the medications that we commonly provide for very important conditions such as depression. Often we underutilize them as part of our solution, and I'd be suggesting that those are very low-tech and very effective ways of doing business. So those building blocks, and I'm going to come back to those building blocks of good mental health, don't just promote our health, they also prevent and indeed treat when we suffer and struggle. So that's just by way of context. About megatrends, so what are megatrends? Megatrends, well, at the end of the day, we think about trends as what's hot or not. High-panted jeans or low-panted jeans. In fact, jeans at all. Or more broadly, cotton as a mode of attire. These are all trends, and when we wind them up and we take those macro steps up, going from micro trends such as skinny jeans or high-panted jeans through to cotton, we start to see emergent issues, megatrends. And that term was coined by an American in 1984, James Nesbitt, to describe several major global trends that he saw impacting the American economy, particularly in the 1980s. So when we think about megatrends, what are we thinking about? Well, we're thinking about several different things. We're thinking about politics, economics, society, technology, legislation, and the environment. Hence the pestle, often referred to as a pestle type analysis. So politics, economics, society, technological, legislative, and environmental changes. What's happening in our environment that we can look at from a world where we stand here, which is relatively predictable, what's going to happen today, to the world tomorrow. What's going to happen tomorrow? Well, maybe President Trump is going to put out another of his wonderful overnight missives and our environment's going to change again. Who knows? That next day is unpredictable. The further we look out, the greater the predictive uncertainty. The purpose of looking at megatrends is to examine potential, likely future scenarios that we can then start to plan for more effectively, as of course the theme of the conference is taking us through. We can see that in mental health when we think about many of the different ways in which we've even conceptualized mental health, going back even decades or centuries just in this country or in Western Europe, where concepts of spirituality and religion have provided a completely different frame of reference historically to discussions that we now have around stuff that often we would think about in this kind of a setting, a psychiatric institution, in fact, a one in Sweden. So those trends influence mental health very directly in that kind of context. What we tried to do, so a little bit about what we tried to do at Vic Health. So put this in context. Vic Health was created as an innovation in 1987, the world's first organization of its type. A tax was levied on tobacco as an unhealthy commodity. And part of that tax was put into the creation of the Victorian Health Promotion Foundation. At that time, to buy out smoking from the arts and from sporting organizations. It's gone on to do very many great pieces of work, and I noted this morning, we're talking about in Ireland a sugar-sweetened beverage tax possibly in the next budget. Wouldn't it be marvelous if some of those sin taxes got levied and put against some of the important causes that we know we could be offsetting? We know that there's huge public support for these type of approaches. So I was working at Vic Health, and we decided at that time, we were interested in youth mental health, of course, and thinking about this from a different perspective. And so we commissioned the Commonwealth Scientific and Industrial Research Organisation, an Australian research body, an organisation which is more commonly known as the inventors of Wi-Fi, and also the inventors of plastic banknotes, which have started to be introduced, obviously, internationally. So we commissioned the CSIRO to conduct a research study And I'll acknowledge in particular the leadership of Gerald Rector, the CEO of Vic Health, for her vision in commissioning this work, and also of Dr. Stefan Hakovitz, who was the actual author of the study itself, and his amazing team at CSIRO, who pulled this together, and of course, through which Vic Health was a major contributor. This study looked at and identified 5 major trends, which I'll briefly outline before thinking about their implications. It is focused from an Australian perspective, so there may be things that, for you as audience members, it may work or not so much in your context, but they are, of course, global megatrends. The first is the rising bar. Now, fundamentally, this is good news, because we are smarter, better educated and better skilled as a global population than we ever have been. We can communicate and pass on knowledge and practices far more efficiently than at any time in previous human history. That is happening in a global context, which is fantastic news. We also have smarter things in our pocket. I have the entire database of all processed foods in Australia on this phone, downloaded just in one app. I can scan any processed food with a food code in Australia on this phone, and it will give me a nutritional breakdown of that. And not only will it give me a nutritional breakdown of it by a traffic light system, it will tell me about the alternatives in that product category that I could be buying to make a healthier choice. Okay, that's called Food Switch, an amazing Australian innovation, one that has been spreading across the world, indeed in the UK. I'm not sure if it's here in Ireland yet, but a fantastic tool. Now, that's just on my phone. Moore's law says that every 2 years, processing capacity of computers doubles. And the latest analyses analysts are thinking that exponential growth of computational power will continue at least until 2025. At least. Now, that's an exponentiating function. This isn't just going to be 25 times smarter than it is now. It's going to be a whole lot smarter again. That rise of computing power has massive ramifications for human life, as it already has. I'm sure everyone is happily tweeting and working on their phone. First thing they do in the morning often is reach over and touch your phone. That's only going to continue. There's also an increasingly competitive global jobs market. I'm going to come back to that. So that's the rising bar. We're smarter, we're better educated, we have better tools than ever before. We also have an increasingly global reach. It doesn't feel like this in the rise of political nationalism that we're kind of living through at the moment, but many of the forces driving globalization cannot be stopped through traditional barriers or indeed of walls that we may or may not be attempting to build around ourselves or around our nations. Many of those barriers will be overcome by many of the global forces driving how individuals, organizations, and societies work. The next one is life's richer tapestry, and this is particularly relevant to an Australian context because in Australia, I'm a very traditional Australian citizen because I'm a British by birth, but I'm a proud Australian now, and I am one of many. 1 in 4 Australians is born overseas. Now, traditionally, that came from Anglo countries, but increasingly, that's coming from whole swathes of different societies across the world. 100,000 new people coming into the city of Melbourne every year. Most of those coming in with great skills and knowledge. Incredible diversity in lived experience. And we're seeing that at the same time as much a wider diversity of how people live and how they express their identities. Sexual identification, gender identification, political and other social identities. There's much more diversity in society than ever before. Now, on one respect, that's absolutely great news because it means that we're able to pick and mix. We're able to stand up and be loud and proud about who we are and what we stand for. Against that, of course, is the breakdown of traditional family structures, of traditional identities within which many find solace. And of course, this is therefore leading to the rise of nationalism internationally, but also within Australia itself, where we see many people wanting to return back to a concept of self and identity which they feel secure with. Now, there's just competing pressures in there. But this is also occurring in an environment where individualization is growing. So we are connecting through our phones, but we're not necessarily connecting with the people we live with or the communities that we live within in the same way as we did historically. Many of the traditions that Bill was referring to earlier around dance and so forth as traditional forms of participation are dropping off. Now, it's our job to then think about how can we bring those into community in a world where more people live in flats, on their own, in smaller family units than ever before. All of this, of course, as I've alluded to, is occurring in a digital format. So this is happening. Our lives online and offline are more and more blurred. Our relationships are more and more based in online relationships where I can organize, for example, on this trip, to meet people who I haven't seen for 25 years through Facebook and through social media, and we can arrive at the same pub at the same time within a matter of hours of arranging that, stuff that previously would have been impossible. There are, of course, many benefits, but also potential harms that come, particularly online victimization, and I think the rise of pornification is fascinating. If we think about one of the most personal things we can possibly do, the management of our body hair, right? We are changing our management of our body hair without talking to each other face to face about it. We're doing it because of what we see, what we hear, and consume through the media, in particular through the exposure often of young people to high levels of porn and related information through the internet. And this is changing, literally, how men and women, young men and women, are managing their body hair. Now, what more powerful a way of communicating the link between social structures and individual experiences there than the way we manage our own body hair without even thinking about it? That's the power of normalization, which is, of course, happening online. A bit of really good news, potentially here, is the rising awareness of mental health. And Francis, and the work of folk like Francis, and many of the youth advocates in this space, and many advocates here more broadly, there is an improved understanding of mental health. Our scientific understanding, our community awareness is transforming, and I have no doubt whatsoever that the contribution of Francis and his team will make a significant difference in Ghana if we take it from decades and years of progress that we've seen to date. This is fantastic, and we're also evolving our service models to meet this. The downside, or the counterflip to that, is if those people in crisis or struggling with their mental health suddenly realize, I can acknowledge this, I can acknowledge the challenges I'm having, and they reach out and they want help, what are our service systems going to do to meet that demand? I know in Australia we are struggling to meet the current demand for crisis services, let alone an untapped demand of many people who are more prepared to talk than ever before about mental health challenges. So that's the 5 trends. So we've got rising bar, we've got globalization, we've got digitalization, we've got destigmatization, all of these occurring at the same time. What does it mean for our systems? Well, the same but different. Different but the same. The building blocks of mental health, of meaning and purpose in life, good work, good relationships, a healthy lifestyle, a supportive social and economic environment remain the same and are likely to remain the same over the next couple of decades for the young people coming through in a global environment. What will change is the context in which those building blocks are formed. And that's the bit that potentially we can influence and be thinking about business differently. How individuals, organizations, and societies respond to change is highly variable. This is the well-known Kubler-Ross curve, a useful metaphor for thinking about some of the different issues and phases people often experience when going through major change, such as bereavement. It has its strengths, it has its weaknesses, but it communicates very powerfully, I think, some of the different and conflicted stages and experiences people have when they go through big change. Now, what's important with this from a global perspective, or from an organizational and system-based perspective, is it's the rate, the scale, and the process of change that are critical in how we will meet these challenges. If we think about something as an organizational reform, so I work in an organization that's had, I think, 4 organizational restructures in the last 2 years. That's a lot of organizational restructure, but I'm sure it's not uncommon. I'm sure many people are counting up in their heads how many of you have been through in recent times. Now, that rate of change is a challenge. If it's big or if it's little, is something different. But the process is also key. If we, as a member of the executive team of my organization, bring the team along with me, the success of those changes is much more likely to be apparent than if it's just imposed from above. So the rate, the scale, and the process of change is key, and our systems, individually and organizationally, will respond in variable ways. Oops, excuse me. Couldn't come here from Australia and not use a surfing analogy. And there's a good reason why people use surfing analogies when it comes to this. We're on our surfboard, surfing. You've got to learn it by doing. You can't read a little plan about surfing. You can get a little bit introduction, but you've got to be in the water to learn how to do it. And then what you've got to do is you've got to figure out, and I say this as a non-surfer, you've got to figure out, what am I going to do about these waves? Is this the wave that I'm going to try and paddle my hardest to get to the front of and go swooping in on? Is this the one that I've got to duck underneath? Or is this the one that's going to land on top of me and smash me to bits? Okay? Now those waves, obviously the analogies are waves of change. If we pick our moment, if we paddle our hardest and we get to the crest of that wave, it can accelerate our progress more than we could imagine. If we get it wrong, or if we decide to go, I'm not listening, the outcome could be very, very different. It took Heinz about 100 years to get from this, the iconic octagonal bottle for tomato ketchup, to this. About 100 years. Fundamentally, this is about user-centered design, okay? That's a much more user-centered design, maybe worse for the environment, but it's a much more user-centered design, easier to use. You get all of your tomato ketchup out of your bottle and so on and so forth. This is a great example of what often innovation theorists call sustaining innovation. So it's thinking about our existing products and services in a more efficient, effective, timely, and accessible way. So we're doing the same thing. The ketchup's the same, but we're delivering it really, really differently and responding to the user's needs fundamentally. And we've got great examples, and I'm just going to call out a couple of great, I'm going to be parochial here, Australian and Victorian examples of innovation in these spaces. Of course, Health Headspace and the work of Pat McGorry, the Origin team, and all the Australian team, and many international colleagues and experts in establishing what is seen as, in many respects, of course, a global movement for earlier intervention, bringing services out to the community and to young people in new and imaginative ways. Fantastic sustainable innovation, only sustainable, of course, if we have funding to support it, a constant and ongoing challenge. But sometimes we need to go even further than that. This is one of Heston Blumenthal's tomato foams. It's tomato, but not as you know it. It's molecular gastronomy, okay? So it's a completely different way of thinking about and conceiving of the experience of eating, let alone of tomato sauce. This is what innovation theorists often call disruptive innovation. Think of, for example, Uber. I know the people who were looking at taxi reforms 10 years ago in Victoria, and a lot of great detailed work went along. We were all plodding along trying to do great work on taxi reforms, and then Uber happened. All of that work became completely irrelevant overnight. The entire business model was transformed. Kodak's probably the greatest example of this. People in the room, some people remember Kodak? A lot of the younger people may not even be familiar with Kodak. Kodak was a massive industry, particularly producing film for cameras, for normal fat cameras. Interesting enough, in 1975, Kodak invented the first digital camera. But they didn't do anything about it. Why? Because they were in the business of selling film. What a mistake that was. They could have been there, the market leading, on the edge. They didn't do it because it didn't fit their current mindset. It didn't fit how we do business, what our business is about. The smartest businesses, of course, look at these trends and think about how you transform your business in order to capitalize on the emerging trends. I'm going over time, so I'll speed up a little bit. Another great Victorian and Melbourne invention. So that disruptive innovation often comes from outside a sector. Not always, but often it comes from outside. And one of the mantras innovation people often use is that if you want to know about things that are going to impact your sector, get out of it. Step outside of your normal frame of reference to think about what could be happening to your industry. Two young brothers in Melbourne had come into contact with men's health issues, and they thought for a bit of a laugh, wouldn't it be great? This is 2003, well before the hipster revolution. And moustaches were definitely out in an Australian context. I thought, wouldn't it be a laugh to grow a moustache, such a male thing to do, to prompt conversations between men about their health? Just to get them talking about it. Many people have wanted to get men more engaged in mental health and other aspects of their health for many years and struggled. This campaign has gone global. It's now called Movember, and it's raised approximately £750 million, and that would be about £1 billion euros, something like that, for mental health and related health conditions for men across the globe. A huge innovation that came in from a totally different way of thinking about how to engage men. Well, how do you do it? You make it a laugh. Make it approachable in a destigmatized environment. It's very hard to get guys to talk about health, but if you approach it from a different angle, you can have a different conversation. So where are we going to end up now? Where are we going to get to at the end of this conference? A lickable tomato soup wallpaper, possibly. That's an image of that. So we don't know where the innovation path will lead us, but we do know that with the great minds and great advocates that we have in this room and the fantastic theme that we have of an opportunity to step up out of our normal day jobs, jump forward 20 years and think about what does success look like from in 20 years' time. I know that's hard to do because we've all got tough jobs. Everybody's got a tough job out there, meeting the demand that's already out there. But that's the great opportunity, the dialogue that we have today. And I'd like to thank you for the opportunity to speak to you and for the opportunity to come here to Dublin and have a wonderful time. Thank you very much.